Hello, for this week we have AW, who is a 16-year-old male with a history of fetal alcohol syndrome, ADHD, and ODD, who presented to our services for evaluation of aggressive behavior. The patient reports that he, quote, lost his anger on an animal on Sunday night, and he was sitting with a puppy that he was taking care of at his house, and the puppy pooped on the floor. So the patient got angry and repeatedly punched the puppy. The puppy started throwing up blood, and on Monday, they brought the dog to the emergency vet, but it unfortunately passed away. The patient was very sorry for what he did. He reports that he has never been physically aggressive toward any person or animal before. Of note, he was adopted at age 5. He lives with his mom and 5 other adopted siblings. He frequently fights with his mom. He reports he only began being verbally abusive and sometimes stepping to her. That's what he says in quote. Mom also reports that Aiden has not been physically aggressive, but she says he's been physically aggressive with him. She endorses punching him in the head 2 weeks ago, recently, and pulling him by his hair and choking him about a year and a half ago. So there is some evidence of some physical abuse in the home. He reports anxiety and wanting to leave his home. His mom gets upset with him. He reports poor sleep, and he says that he uses marijuana. He smokes it daily, and the last time he smoked was this morning. And he says that it helps him to escape and calm down. He states that he has had mood swings when his house gets, quote, hectic. However, he does deny SI plans or intent, and he denies a history of suicide attempts. He does report that he had SI in the past when he was 12 and 13 due to interpersonal problems, but he doesn't want to discuss them during the interview. He did deny HI, denies auditory and visual hallucinations, and paranoia. The patient does feel that he needs help um, with his medical with some medications because he knows that using marijuana to help him escape at his age is not good for his health. Um, he feels that he does need therapy, so that's why he's happy he came to the hospital for help. Some collateral information was obtained from his mom, who has some safety concerns, including concerns for safety for the other siblings in the home, given the amount of aggression that he showed toward the dog, and the dog subsequently passed away. But while the patient was in the waiting area, he was appropriate for his mental status. He appeared neat and well hygiened. His behavior, he was able to make eye contact, and it was fair. His demeanor, his manner was cooperative, and he was actively engaged in the conversation. His speech was normal rate, rhythm, volume, and prosody. His mood, he said, was, quote, mad at himself. His affect was in full range. He was tearful on the beginning of the interview. His thought process was linear and goal directed. His thought content, he denied any suicidal or homicidal ideations. His perception, he denied any psychotic symptoms, including auditory and visual hallucinations. He was oriented to person, place, time, and situation. His attention was within normal limits, and so was his concentration. His memory was grossly intact based on uh, um, the recall of remote and recent was also accurate. Um, his fund of knowledge was within normal limits. His impulse control, however, is poor, given why he came to the hospital for help. Um, and judgment was marginal. So for his access 1, he has autism spectrum disorder. Access 2, the client did not display any signs of mental retardation because his speech was fluent. He was able to maintain a standing position without assistance, and he was able to make eye contact during the interview. there was no signs of personality disorder due to the limited information that we were able to get during the interview. Access 3, um, he appeared to be in moderately good health given his normal weight, um, and intact skin. He was able to walk, and it was an even gait. His speech was clear. Access 4, he is under stress being in the home, as given that he is being like potentially abused. And Access 5, his overall function was a 70. And the resources that I used during this presentation was the DSM-5 by the American Psychiatric Association and Stahl's Prescriber's Guide. Thank you.